Welcome back to the deep dive. Today, we're going to be, really diving deep into a topic that people, I think, are kind of hesitant to talk about sometimes. Hysterectomies. We're here to, give you the straight talk and the need-to-know information about this procedure.
Yeah, it's a big one, and it's way more common than I think a lot of people realize. Hopefully, by the end of this deep dive, you'll feel, much more comfortable with everything that a hysterectomy entails.
Absolutely. So, what are we talking about here? What is a hysterectomy? Our sources define it as the surgical removal of the uterus. Simple as that, right?
Well, not quite. We have to consider the why. Why are these procedures being done? And our sources point to three main reasons. Fibroids, endometriosis, and uterine prolapse.
Right, and we can't forget about those instances of, uncontrollable bleeding after delivery, even after massage and medications have failed. That can be a major reason for a hysterectomy as well.
You're absolutely right. And it's also important to remember, there isn't just one type of hysterectomy. Our sources outline three main types. And, well, the right one for each patient really depends on their individual situation.
Okay, so let's break down those different types. First up, we have the total hysterectomy, which I think our sources said was the most common type.
That's right. Total hysterectomy means the entire uterus and the cervix are removed.
Got it. So everything's gone. And then there's the partial hysterectomy, which is where they only remove the uterus and the cervix is left in place.
Exactly. And finally, we have the bilateral salpingo-oophorectomy, or BSO.
Okay, try saying that 3 times fast. What does a BSO involve?
Basically, it means removing both fallopian tubes and ovaries along with the uterus. So a lot more is being removed in this type.
Right, so it sounds like the type of hysterectomy you have would really impact what recovery looks like. But our sources also talk about the surgical approach, meaning how they actually perform the procedure and how that can vary too.
Yeah, you've got a few different options there as well. One option is a total vaginal hysterectomy. So, as the name implies, the uterus is removed through the vagina.
So no incisions. That sounds preferable.
It can be. It often means a quicker recovery time and no abdominal scar. But, depending on the size of everything, it can be a little more difficult for the surgeon to, have clear visualization and operating space.
That makes sense. So what are the other options if a total vaginal hysterectomy isn't, the right fit?
Well, there's also the laparoscopically assisted vaginal hysterectomy. Essentially, they use a laparoscope, which is a thin tube with a camera, for a minimally invasive approach.
So there are incisions with this one?
Yes, but they're very small. It generally means less pain, quicker recovery, and is less expensive compared to open surgery.
Got it. So when would this approach not be possible?
Well, in some cases, a larger incision might be necessary. For example, if there's a lot of scar tissue, or if the uterus is especially large.
Makes sense. So what's the other approach our sources mention?
The other one is a total abdominal hysterectomy, or TAH. It involves an incision in the abdomen, and it's usually the way they go if they suspect cancer or if the uterus is just, really large.
Okay, and our sources mention that recovery from a TAH can be a bit tougher.
Yeah, it's more intense. Often means general anesthesia, longer hospital stay, longer recovery time, more pain.
Yeah.
And it's more expensive. Plus, obviously, you'll have a scar.
Okay, so clearly a lot to consider when we're talking about surgical approach. Anything else we should know about different ways to perform a hysterectomy?
Well, there's one more that our sources mention. Robotic-assisted laparoscopic hysterectomy. They don't go into a ton of detail, but there's a link to a YouTube video if you're interested in seeing what that actually looks like.
Always good to have visuals. Now, I think it's important to address that preparing for a hysterectomy is about a lot more than just the physical aspects of it.
Yeah.
Our sources actually talk about, addressing the emotional and psychological needs of the patient.
Absolutely, yeah. It's about treating the whole person, not just the medical chart. Things like age, cultural background, relationship status, and the reasons for even having the surgery can all really impact the emotional experience.
That makes a lot of sense. So what does that kind of support look like in practice?
It starts with really honest and open communication between the patient and their doctor. Mm-hmm. This is the time to address any fears, concerns, or, even just basic questions about the procedure and what it'll mean for their life down the road.
So it really sounds like preparing for hysterectomy can be as much a mental and emotional process as it is a physical one.
It really is. Our sources really emphasize educating yourself before the surgery about the procedure, how to prepare, the potential risks, anesthesia, what recovery will look like, all of it. The more you know, the better.
Yeah, knowledge is power, for sure. The more you know going into something like this, the better. So let's talk about that after part, the recovery. Our sources had some really helpful tips for that.
They did. Like, one thing they mentioned was making sure you're supporting your abdomen, when you're coughing especially.
Oh, interesting. Like to help with the pain.
Exactly. It's like splinting the area.
Yeah.
And deep breathing is super important. They even suggest using an incentive spirometer.
Okay, for those of us who don't know, what is an incentive spirometer?
Basically, it's this little tool that helps you take slow, deep breaths, which is really important after surgery to help prevent any lung issues.
Oh, okay, that makes sense. So you're focusing on your breathing, supporting your abdomen. Are there restrictions on activity too? I imagine you can't just jump back into your routine after surgery.
Yeah, no marathons right away.
Yeah.
So to take it easy for 4 to 6 weeks, rest is really key.
Yeah, I bet. And I imagine fatigue is a big part of that, right?
Oh, absolutely. Our sources say to expect, you might be tired, your appetite could be a little different, even your bowel movements might be off for a bit. It's all totally normal. Your body's been through a lot.
That's wild how much your body goes through, even just to recover. Speaking of, our sources mentioned vaginal bleeding, and I have to admit, I was a little confused by that. If there's no uterus, why would there be bleeding?
That's a good question. It's actually pretty common to have a little bleeding after surgery, even without a uterus, just because, there's still healing happening from the procedure itself.
So a little bit is normal, but how much is too much?
Right, that's important. They say to definitely call your doctor if the bleeding is really heavy or if it's bright red.
Okay, good to know. So while you're recovering, what are some of the things you should be keeping an eye on?
Monitoring is key, yeah. Checking your temperature, your pulse, blood pressure every few hours. Listen to your lungs, make sure everything sounds good, and keep track of, how much you're drinking and how much you're peeing.
All those basic things we kind of take for granted. Our sources also mentioned some potential complications. Did any of those stand out to you?
Well, it's always good to be aware of the possibilities. Things like infection, obviously, or hemorrhage, thrombophlebitis, and then any injuries to the genitourinary or gastrointestinal systems.
Thrombo what now? That sounds a little intense.
Yeah, it's a mouthful. It just means a blood clot. Not something to be totally worried about, but definitely something to look out for.
Right. So knowing the signs, watching out for anything weird, and calling your doctor right away.
Exactly. Early intervention is always best. And, beyond the physical recovery, our sources talk a lot about the emotional impact, which I think can be easy to overlook.
That's true. It's a big thing to process emotionally. What were some of the emotional considerations they mentioned?
Well, one of the questions they pose is, does she feel okay that she can no longer have children? And for some women, that's huge. It can bring up a lot of complicated feelings.
Yeah, like grief even, or a sense of loss.
Exactly. And our sources really encourage doctors to be aware of that and, to have resources available, like maybe referring them to a therapist or even just having some websites they trust with information about life after a hysterectomy.
Right. It's about supporting the whole person.
Yeah.
I also noticed our sources talking about hormone replacement therapy. How does that tie in?
Well, if the ovaries are removed during the hysterectomy, it basically throws the body into immediate menopause.
Oh, right. Because you weren't producing those hormones anymore. So HRT is something to talk to your doctor about if that's the case.
Exactly. It's all about, figuring out what's right for you, weighing the risks and benefits and all that. Speaking of long-term stuff, our sources also had a really interesting question about whether you still need gynecological exams after a hysterectomy.
Oh, wow. Yeah, I never thought about that. You'd think once the uterus is gone, you're off the hook.
Right. But yeah, they basically say to talk to your doctor about your individual needs and what makes sense for you.
So it's really about that personalized advice. What other takeaways should we keep in mind from all this? I think that's a really important point that keeping that open communication with your doctor going before and after can really, just make sure that you're getting those individual questions answered.
Absolutely. That ongoing conversation is so essential. And, even when you're home recovering and hopefully feeling better, you still got to be aware of those, those warning signs we talked about.
Right. Like fever, heavy bleeding, problems peeing, really bad pain. None of that is okay, even weeks after surgery.
Exactly. Don't mess around with that. Call your doctor right away if something feels off.
Trust your gut. It's your body. So, I guess that's a good takeaway right there. Be proactive, advocate for yourself, right?
Yeah, 100%. Knowledge is power. The more you know about hysterectomies, everything from the different types, how they do it, recovery, what to expect long term, It all helps you make the best decisions for yourself.
Totally. And, even if you're not facing this procedure yourself, maybe you know someone who is, come back and listen to this again. It's a lot of info, but hopefully it helps you feel informed.
We hope so. It's such a personal journey.
Yeah.
And we just want to make sure everyone has the info they need to feel good about it.
And as always, we try to be accurate and up to date, but nothing replaces actually talking to your doctor.
Totally. They're your partner in all of this, so don't hesitate to, really use their expertise.
For sure. Well, on that note, until next time, deep divers, stay curious and take care of yourselves.